Hi, my name is Chaim Putterman. I'm a rheumatologist. I'm also chief of the Division of Rheumatology and professor of medicine, microbiology, and immunology at the Albert Einstein College of Medicine in Bronx, New York. So there are many exciting things in rheumatology and in rheumatic autoimmune diseases. I think the most interesting thing to me is the advent of biologic therapies. These are targeted therapies for the immune system to allow us to treat our conditions much more effectively and safer with better results for patients. So I've been coming to these conferences for years. The attendance is growing, the number of presentations are growing. You come here, you hear leaders in the field bringing the best of science and medicine in autoimmunology from Europe, the United States, Australia, Asia, and basically all over the world. There is increasing importance in understanding the role of B cells in autoimmune diseases. Our therapies to date have been, at least up until a few years ago, have been relatively non-specific. If B cells are important and we know how to target them, we will be achieving better results. So indeed this session will focus on the important role that these B cells had, and if that's true, then we should be dedicating our efforts to targeting B cells as a therapeutic target. Indeed, there is a B cell specific antibody that depletes B cells specifically, and there are also many other types of therapies that are being developed that allows you to specifically modulate this important immune cell subset. After our session today, I think we have to recall the centrality of B cells in the pathogenesis of autoimmune diseases. Not only autoimmune rheumatic diseases, but a broad category of autoimmune diseases in which the B cells are important. Biologic therapies, targeted therapies, novel immune modulators are going to continue to grow. We're going to have new ways of affecting and modulating the immune system. That is one. Number two, I think there's a tremendous move towards personalized therapy and personalized medicine. We have, for example, 9 different biologics that are already approved in the United States for the treatment of rheumatoid arthritis, and the physician that treats these patients is faced with the decision which biologic to choose. We need to find better ways of targeting specific medication to specific patient categories, whether it's through gene expression arrays, biomarkers, synovial fluid markers, whatever it is, we have to find ways in which to identify patients that are likely to respond to a given medication before we start giving them that medication. Many more people are attending, and the quality gets better and better. I don't know how it can get better, but it is. We're hearing more presentations, more lectures, more leaders in the field from different countries, the chance of interacting with multiple scientists and physicians that come from all over the world, all that are interested in the same thing, and that is in furthering the science and the medicine of treatment of autoimmune diseases. I try to bring my students and my postdocs to participate in these conferences when they can. It's a very open and collegial atmosphere in which young professionals are encouraged to present, to ask questions, to network, and we're happy to talk to everybody.